Rich from NYU, who's going to start us off.
Terrific. Welcome, everyone, to today's webinar on the City Health Dashboard. It's a sneak peek, and we're delighted to have you all on board to present what we are very excited about here. I wanted just to begin by going over a couple of housekeeping items, and then we'll introduce the other presenters as they come online. Beginning with the fact that the webinar is being recorded, so just that you know that, and it'll be shared after the public release of the dashboard. There are a couple of features that will allow you to communicate with us. There's a raise your hand feature. If you can, if you would like to make a point, or if you can't hear us, and you can find that by clicking on the participants button if you don't have it easily visible already. You can contact us via the webinar's chat feature if you have any technical difficulties or want to submit questions for Q&A. Your phone lines are muted, as are all of ours except for the phone line of the presenter. So if you do say something, we won't register it. That's why these communication options that I just mentioned. And lastly, just to, we're going to present about this new resource, the City Health Dashboard. Its formal release is going to be in mid-May, May 15th. And so it's basically embargoed until then. And so we just appreciate you not sharing directly the information that we talked today. What we're going to do, really our objectives here, are to provide an overview of the dashboard and of how neighborhood and city level data can enable communities to target interventions and be more effective in improving health. We're going to share with you some of the website's unique interactive features. We'll showcase a pilot city that is using the dashboard's data to drive change in their community. And we'd like really to share with you our own sense of urgency around the fact that people living just a few miles apart can really have vastly different opportunities for health and well-being. So as we go through, we really so encourage you to share your thoughts with us via the chat. For example, as you begin to see some of the data capacities of the dashboard, please tell us how will you how you plan to use the dashboard's data. We're keen to know and to respond to you. So next up is our colleague at the National League of Cities, Kitty Dana, and who is a bridging partner in this effort, and so it's a pleasure to introduce Kitty.
Okay. Hello, can you hear me?
Yep, Kitty, you're on.
Okay, wonderful. I keep hearing the message that I am muted, so I wasn't sure and don't want to say anything to embarrass myself. Well, good afternoon and good morning to colleagues across the country. I am very happy to be here today on behalf of the National League of Cities and want to extend a welcome to all of you. We have the privilege of being a partner along with ICMA for NYU's City Health Dashboard, and we are very excited about the upcoming launch. NLC is dedicated to helping city leaders build better communities. We are a resource and advocate for 19,000 cities, towns, and villages, representing more than 218 million Americans. Our health and wellness work is focused on factors that drive health and well-being for people, neighborhoods, and cities writ large. Education, employment, housing, poverty, race, social inclusion, and other factors in the context of our lives that affect how long we live and how well we live. In cities, multiple factors affect how people's daily lives come together, and people really get that all these factors come together in the cities. And mayors, city managers, council members, and other city leaders have a particular role to play to advance opportunity and equity in the cities. To do so, it is vital to have data, and moreover, disaggregated data, to zero in on areas of greatest need, and as Mark said the other day, to galvanize municipal action. City Health Dashboard provides a needed online resource for all cities with a population of 65,000 and greater, a free public utility for city leaders, stakeholders, and all who work with cities. It presents data that embrace the spectrum of factors that drive health. It has data down to the specific neighborhood level, and it offers something that many leaders have said that they want, the capacity to compare with cities that look like us across a range of factors. I look forward to hearing more about the dashboard on this webinar along with you. And now we are going to ask if you would share your thoughts via a chat. What organization are you with?
And we're going to turn it over to Andrea Fox from the International City County Management Association, ICMA.
Great, thank you. Can you hear me?
Yep.
Excellent. Hi, everybody. This is Andrea. I'm here on behalf of ICMA, the International City County Management Association. Thank you all for being here to learn more about the City Health Dashboard. For those who don't know about ICMA, we are a professional association for local government staff. We were founded in 1914, and we have over 11,000 members that we serve. These tend to be the chief appointed officials, so these are your city and county managers and other local government staff. In addition to our members, we also have a strong international reach, and we work with over 30 international affiliates, and our affiliates are associations of local government staff that are in other countries that we work with. At our core, we are in the business of improving the capacity of local governments and our members, and we do this through a lot of different ways. We offer professional development and training. We've been doing survey research for a couple of decades. We do white papers, and we manage various projects that are funded by the federal government, foundations, and others. On the, previous slide, you can go back one. Here's a few examples of different projects that we've worked on that are relevant to public health. And then, of course, we are also, as Kitty mentioned, a supporting partner of the City Health Dashboard. Next slide, please. So our main role with the project is that we are an outreach partner because we want to make sure that local governments are aware of this valuable resource, and we want local governments to be able to incorporate it into their own community planning. We also provide an important local government perspective along with the National League of Cities and, of course, the communities that were a part of the pilot. And then lastly, the communities that participated in the pilot were also involved with another project that both ICMA and NYU were a part of, which is the National Resource Network. I've given a link here in case anybody wants to learn any more about that. And ICMA helps provide a link between that project and the City Health Dashboard. Next slide, please. So here's some examples of some of the outreach channels that ICMA is using to let communities know about the City Health Dashboard. These include our newsletters, our magazine, websites, social media, et cetera. And then in addition to our channels, of course, we'll also work with our partners who we work with on all kinds of other programs here at ICMA. And we'll use these channels as well as others to make sure local governments are aware of City Health Dashboard when the site is fully launched. Next slide. So in closing, I would just add that ICMA is really proud to be a part of this project, and we look forward to seeing how you all are going to use this in your own communities. And if anybody has questions or wants to learn more about ICMA, here is our website and my contact information. And I will now pass it back over to Mark to describe the dashboard.
Explain that we are coming to you today, or I am, from the Department of Population Health at the NYU School of Medicine. And really, all of this work is done in strong partnership with colleagues here and with our bridging partners, the National League of Cities, ICMA, the National Resource Network, and our early partner cities as well, including, of course, Waco, as you will hear shortly. So how did we come about to create the City Health Dashboard? It really is an idea that grew out of work that a colleague of ours was doing with the National Resource Network, and in speaking with city leadership across the country, just sort of observing that many mayors and city and community leaders wanted to address health needs in their towns, in their communities, in their cities, but really lacked the kind of local data on health factors that they had actually for other kinds of issues like poverty, housing, transportation. And so if you look at the next slide, there was basically an abundance of data about health at the county level, but not at the city and sub-city neighborhood census tract level. And so that's really what we set out to address. And as you can see in this image, most city boundaries don't actually match up with their respective county boundaries. So on the top left, you have Flint, Michigan in the dark purple that sits inside Genesee County. On the top right is Providence, Rhode Island in Providence County, Waco, Texas in McClellan County, and on the bottom right is Kansas City, Kansas in Wyandotte County, where, as you see, the boundaries actually do almost line up. So there, county level data could be quite useful, and indeed are quite useful. But for the other cities, and for many of your cities, you know, there's the population of the county as a whole may look different from and have different health measures and statistics than that of those city residents. So it was that really made us realize that we wanted to put data about cities' health and the drivers of city health in directly into your hands. The next slide shows a map of the U.S. And what we've done with the dashboard is essentially to take to look to equip cities with a one-stop resource that would allow users to view and compare from multiple sources data on their health and the factors that shape health, really to support cities and communities in building healthier and more equitable communities. So we initially built the site actually working in close partnership with 4 pilot cities: Providence, Rhode Island, Kansas City, Waco, Texas, and Flint, Michigan, the cities that you saw in the previous slide. But then really building on the strength of that experience, have now scaled that scaled it as a resource, which we're going to demonstrate for you in a little bit, for all 500 cities in the country that are a population of about 66,000 or above, which is the largest 500 cities in the U.S. And that is what you see there on the map. And the data that is populating, that we're working with to define the health of and drivers of health in these cities comes mostly from publicly available national data sets that we have then worked with to calculate city and census tract level values for. So the way that we've gone about doing this is really in very close partnership with a number of city and community leaders around the country, with other outside experts. We've spent time in a number of cities speaking with leadership and community leadership about what would actually be useful. We came up with a big set of measures. We whittled it down to those that were most sought after. We built a website, got a lot of feedback on it, improved it greatly with a lot of sort of beta testing. And so we really, our goal in all of this was to design a tool that would be actually useful to you. And we hope that you will find that it is. How did we pick? So in the end, as you'll soon see actually on the next slide, but don't go there yet, there is a list of 36 measures, and those are the 36 measures that are on the website that we have calculated for each of your cities. How did we pick those 36? Well, we wanted to work with data sets that really were collected according to very rigorous methodologies. We wanted the measures to address important public health priorities. We wanted them to be actionable. We didn't want to include measures that nothing could be done to change. We wanted to find measures that could be updated regularly so that we're relatively current, and that are balanced across 5 overarching domains, as you'll see now on the next slide. So this is a slide that shows the measures that are embedded now in the dashboard that you'll see soon for each of the largest 500 U.S. cities. And they're in these 5 domains: clinical care, health behaviors, physical environment, health outcomes, and social and economic factors. And our philosophy here was really to blend a mix of measures of health itself and of health care, but really blend that with the measures of the other factors outside of the healthcare system that really drive health in the first place. The so-called social determinants of health, environmental and social and economic determinants. And with that, we came up with this list. And I'm actually going to take a moment and just go through it with you. We looked at about 5 measures of clinical care that you see here: prenatal, primary care physicians, preventive services, dental care, health insurance. We looked at health behaviors and some health outcomes: opioid overdose deaths, teen births, adult smoking, excessive drinking, and physical inactivity. Some measures of the physical environment: air pollution, access to parks, walkability, limited access to healthy foods, and 2 measures of lead. And then a number of health outcomes: mortality from breast cancer, premature mortality, cardiovascular disease, colorectal cancer, and then some measures of low birth weight, adult obesity and diabetes and hypertension, and then 2 measures of overall physical health and mental health, and a number of social and economic factors, some related to education, which is a powerful driver of health, absenteeism, reading proficiency and high school graduation, and then poverty, especially children in poverty, income inequality, neighborhood, racial, ethnic segregation, racial, ethnic diversity of neighborhoods and cities, housing costs, unemployment, and violent crime. So a lot of data. And they're drawn from these national data sets that you see in the right-hand column in each case. So if you advance, it is my pleasure to introduce my colleague Shoshana Levine, who will actually now do a brief demo and show you, well, what are we talking about here? Shoshana.
Well, thank you very much. Let me just get control of the screen. That is not what I wanted to do. Can you make me a presenter, Michelle? Okay. Great. Okay. So you should all now be able to see the City Health Dashboard homepage screen. So there are a lot of really great features on the City Health Dashboard, a lot of really interesting things that you can do with this resource. And over the coming weeks, we'll provide additional tips and insight. But today, we're just going to give you a quick sneak peek and a test drive of the site before its official launch on May 15th. So what you can see here is the homepage, and I will zoom out of them. We've spent a lot of time in development to make this a site that is really intended for city officials, advocates, and policymakers. And of course, we hope researchers use it too, but we really see this as a resource that can help communities have conversations and start new partnerships. And that's why it's really grounded in this first call to action: explore health in your city. And so I'm just going to give you a quick demo that will show you how you might use the dashboard to set priorities for health improvement in your city. So we'll just type in a city, and today I will choose Atlanta for this demo. And you can see here the first thing that pops up is our metric selector. And so these are the 5 domains that Dr. Gravich just went over. And within each of them, we see the same measures that he just showed you. I'll open these quickly for you. And then we can go back to our obesity measure. And so this is a measure that you, I'm sure, have seen many times, that you're familiar with. And you can see kind of an intro to the city of Atlanta up here, the population, region, and site, as well as some information on the measure that you're looking at here. So our measure that we're exploring is obesity. And here's the definition. And you can click here to learn more about where this data comes from, when it was collected, and some more information in greater depth. If you click on this link, it will take you to another place on the site. Then what we get to here is the city value for obesity in Atlanta, Georgia. And this is the common way that we're presenting data across the site with these scale bars. And you'll see consistently across the site, lighter colors will indicate better outcomes, but that sometimes might switch between lower values and higher values. So for a measure such as obesity, a lower value will indicate a better outcome, but for something like high school graduation, a higher value is what you're aiming for there. So just to orient you a little more to the site, we can see here this yellow bar indicates the city or census tract value. The number under this triangle is the average of all of the 500 cities within the site. And this little green check here would be present if Atlanta was doing better than our 500 city average, but it's not, so we don't see the check there. So now we can scroll down to a map further down the page where we can see what obesity looks like across census tracts in the city. So, and again, darker colors indicate a higher level of obesity. And so there's actually a pretty striking pattern here where the north and eastern parts of the city are clearly have lower rates of obesity, and the southern and western parts have higher rates. And if you want to dig a little deeper into any one census tract, I'll click a few that are lower than or have lower rates, and then a few that have higher rates. And so you can see here, you can compare with the city average up here, and then some of the census tracts that are doing better than the city average, and some of the census tracts that are doing poorer than the city average, as well as the 500 city average. You can also click into any one of these to get a little more information about the numbers that are behind any one scale bar there. So, so obesity is an issue here and something that we might want to take some action on. But thinking about how we might want to take action, we can look at some of the social determinants of health. And one that's been shown to be quite important across the lifespan and across different health measures is children in poverty. And this can be a really important measure because poverty disproportionately affects minority children, and negative health effects of childhood poverty can be severe and last through the life course. So we can look at our children in poverty measure, and again, as you're looking at this, just remember that lighter colors mean more positive outcomes, meaning that there are fewer children living in poverty. So again, up here at the top of the page, we have the metric information, as well as the value for Atlanta, which is 38.1% compared to the 500 city average of 23.6%. And if we keep scrolling down to the map again, we can see that there's actually a pretty similar pattern to what we saw for obesity, where the northern parts of the city are lighter and the southern parts of the city are darker. And you can see here some of the census tracts that we looked at before, again, show similar patterns. But again, you can also see that there are a couple of outliers, cities or census tracts that had low obesity and high child poverty, as well as census tracts that had high obesity and low child poverty. So these might be areas to focus down a little more and to really dig deeper into what's going on in these communities. So, so this is kind of just one way to look at the data, and we have a couple more across the site that I'll show you as well. So the next thing that you could look at is a demographic breakdown of this measure. So children in poverty is one of our measures that we can look at by census tracts as well as by demographic groups. So if I scroll down again, we can see the city average and the 500 city average. And then a little further down the page, we get the breakdown by demographic groups. And you can see here that what we're seeing is the population of the city that's represented in that demographic group. So 2.1% of Atlanta's child population is Asian, and they have a child poverty rate of 23%. And if you look further down the page to the different racial ethnic groups included in the dashboard here, you can see that the Black population, which represents a sizable majority of the city, has a much higher child poverty rate, as does the Hispanic population, although that's a much smaller percent of the city, whereas the white population, which is about a quarter of the city, has an extremely low child poverty rate. And then this other group as well is doing slightly better than the national average there. So, so you can see here that even the 500 city average changes across the different groups, but even acknowledging that, there are huge inequalities between groups in Atlanta. And so after digging down into one measure, you can then also get a snapshot of all of the measures within your city. So I'll just open all of these here, close out, and you can see here how Atlanta is doing on all measures within the dashboard. And you can see for the measures that Atlanta is doing better, there's this green check, and for all others, there's no check. So the idea here is just to give you an idea of perhaps where you might want to focus down, where you might want to get some more information to see what's going on behind these numbers. And if you click on any one measure, you can again get more information, including the map and the scale bar, the numbers behind what's going on there. So the next feature, just getting out of this quickly, is something that I'm really excited about, as it's something that one of our pilot cities actually told us that they were really, really in need of. So Kansas City, Kansas is one of our pilot cities. And when they're looked at against the other counties within their state, which is how they often get health data, they're a very urban county in a very rural state. So they're usually at the bottom of any list. And it's really hard for them to either benchmark themselves or to make progress compared to other counties in the state. And so they're looking for cities that look like them, that they can make comparisons and set benchmarks to really show their progress. So we have a comparison city feature within the dashboard. And so if you know what city you want to compare yourself to, you can look at it here. And so we can say Birmingham, Alabama is one that's a good comparison for Atlanta, Georgia. You can see clicking on it adds it to the list at the bottom of the page. But what you can also do is use our filters to help you find cities that look like you on different characteristics. So we have a list of more general characteristics and population demographics here, as well as all of our dashboard metrics. So you can find cities that look like you on any of those measures as well. And so if I choose cities with similar unemployment rates, maybe in adjacent states, and similar levels of, or similar federal poverty level, that will give me a list of cities down here. And if I choose Columbia, South Carolina, it'll then add it to the list at the bottom here. And so you can compare these cities, cities that look like you. And then you can also at the bottom see the comparison by demographic groups within these cities. And if you can take a look here, you can see that there is significant variation between demographic groups within cities, even where the city values are also very different. So now going back full circle to where we started in the beginning with obesity and children living in poverty. One of our last features in the dashboard is a metric comparison function. So if I have children in poverty already selected, and I can look at obesity, neighborhoods, their rates of obesity and children living in poverty. So you can see here in this scatter plot that neighborhoods that have higher rates of children living in poverty also tend to have higher rates of obesity. And it's not a perfect correlation. And it's kind of, it's not a a be-all, end-all to all of the research that you might want to do around these issues, but it kind of gets you thinking about where you might want to go and what you might want to dig deeper into. If you click on any one of these dots, you can see the rates of the two measures for any particular census tract within the city. And then finally, what we've heard a lot is that, it's great to see how things look in our city, but now what? What do we do with all of this information that we have? So here we have our Take Action section, where we're compiling evidence-based resources for making change within communities. So you can see here, we have the American Academy of Pediatrics policy statement on child poverty and health for this one particular measure. And we have, a list of other resources for every measure. And if you click on this right here, which I won't do right now, but it will link you directly out to that resource so that you're able to dig in, get some resources right from the source and see how other communities are making a difference in the areas that you're interested in exploring. So there's a lot more that you can do with this site, a lot you can do here, and I'm really happy to go further into detail and explore a little more if anyone has any questions during the Q&A. So I'm gonna stop sharing. If you want to get the slides back there. And so while they're getting, while they're getting the slides up, I'll just ask you, you can type in during the chat, what features are you most excited about using on the dashboard?
Terrific, and we've been seeing some of your questions emerge as we've been going through, and shortly we'll turn to that part of the conversation. So this is Mark again. Thanks very much, Shoshana, and to all on the call. We hope you are intrigued by what you saw. I want to just make one brief point, which is that I hadn't made earlier, which is another partner in this has really been the Centers for Disease Control and Prevention, the CDC, in that they did the hard work of calculating the a number of the measures from the Behavioral Risk Factor Surveillance Syndrome system, BRFIS, which we essentially borrowed for about 11 of our measures. So you see that it's referred to on the slide that I went through with all the measures, but as we were giving the obesity example, it occurred to me to just emphasize that, since that's one of the BRFIS measures. So looking ahead, if we go to the next slide, really just a couple brief points. We're looking forward to launching this and making it available to everyone. It will be widely available, no cost. No affiliation necessary. We hope down the line to be able to really customize it further to the needs of specific cities, for example, if that becomes a priority for whether further data linkages, tailored analyses, maybe additional geographic breakdowns or other visualizations. Next. And there's, with every good thing, there are challenges and opportunities. One challenge is that if we want to measure change, let's say that you use the dashboard to help set local priorities, and you undertake an intervention to increase physical activity, you may say, oh, this is great. Can we use the dashboard to see how we're doing over time? And the answer is yes and no. But the no part is that that since we are relying on national data sets for our data, the speed at which they will change and change will be reflected is slow. And so cities may find it more effective to do local data collection to measure change than necessarily to rely on the dashboard in real time. Same with evaluating impact, communicating uncertainty. Some of these numbers are estimates. Or with any numbers, there is a usual confidence interval or a margin error around them, and so we want people to be using these data, obviously, but we have to think a little bit about how do we communicate so that people are really feeling confident about them as they move forward and act upon them. In terms of opportunities, we think that the data in the dashboard will really allow cities and communities to pinpoint their highest priorities, to target scarce resources, therefore, and really to improving health and well-being, and to exploring best practices and resources for driving change across communities. So that's the overview of the dashboard. What I think is most important is to hear from colleagues who have actually put it to use. And so it's a pleasure to turn to our colleague, Brittany Fitz-Chapman, who's Director of Data and Research for Prosper Waco. Brittany.
Thank you. Can everyone hear me?
Yes.
All right, wonderful. Thank you. Waco, Texas is honored to have participated in the pilot of the CH Dash, and we are really excited for the launch of the newest version that you guys just previewed. As Mark mentioned, I'm Brittany Fitz-Chapman, and I serve as the Director of Data and Research for the Prosper Waco Initiative. Prosper Waco is a collective impact initiative focusing on improving education, health, and financial security outcomes in the greater Waco area. As the community's backbone organization, our role includes working closely with partner organizations to advance collaborative projects. And for this project, a vital partner is the Waco-McLennan County Public Health District and more than 350 partner organizations across our community. Another role we serve in the community is driving the framework of data-driven decision-making and how to capitalize on projects like the CH Dash to inform strategies and efforts within the initiative. And one of the reasons Waco was chosen to participate in the pilot of the CH Dash was because our city falls entirely within McLennan County. McLennan County has about 230 residents, and about 125,000 of those residents live within the city limits of Waco. Typically, when initiative groups are looking at health data, they're looking at data that lags by several years and is often limited to the county level. We suspected from programmatic level data and hospital data that the great health disparities exist within our community, but from the county level data was washing out any effect that we could see. Having the City Health Dashboard providing recent city level data is critical to how our community makes decisions, and in most of the indicators the CH Dash highlights, initiative partners can view the data at the census tract level, which allows interventions and strategic efforts to become even more targeted when necessary. So I'm going to tell you about two examples of how our community is using the data provided by the CH Dash. In the fall of 2017, Waco-McLennan County Public Health District hired 11 community health workers to help local residents navigate the complicated healthcare system that we have. These individuals are not health professionals, but have been trained through a 160-hour community health worker accreditation through the state. They live, work, and play in the zip codes where they are assigned, and they are truly the trusted source of information in their community. A task of the community health workers is to host community events to help spread awareness about health issues in their area. By showing the CHWs how to use and navigate the CH Dash, they were able to see the health outcomes for their specific area and started brainstorming intervention efforts. For example, one team is going to focus their efforts around diabetes prevention, while another team will focus on mental health-based outreach programs based on the Poor Mental Health Days indicator that the CH Dash provides. Having this information in a format that is friendly and usable by initiative partners and community members is really making a difference. The democratization of data in the Waco community is a priority, and the CH Dash is the perfect tool for the job. Additionally, we are using the data from the CH Dash to inform the work around an initiative effort called the Workplace Wellness Scorecard. The Workplace Wellness Scorecard is a tool to help assist local employers in taking steps to support their employees' health. The team specifically looked at adult obesity rates and physical inactivity indicators to strategically design the framework and determine the extent of the scorecard. It is a complex process of decreasing poverty rates in our communities. Organizations are working hard to serve their clients with the limited resources available to them, and often wish for data at the city level to be able to more strategically implement their efforts. The CH Dash's compare metrics feature is great to remind communities that the situation is often more complicated than we realize.
To be able to visualize the related nature of some of the health indicators to education or income indicators is a great reminder that it really does take a collective effort across sectors to begin to see the movement in improving health, education, and financial security outcomes.
Great to hear.
I guess at this
go ahead.
Yeah, I was going to say at this point, I think we're going to take some questions.
Yeah.
That's exactly right.
Thank you.
Alicia.
Yes, thank you, Brittany, so much. So at this point, I'm Ryan. I'm with Burness, and I'm going to be helping to facilitate the Q&A portion of this webinar. And I thank you, everyone, for submitting questions. And if you have additional questions for Brittany or any of the panelists after their presentations, feel free to use the chat feature. So I'm going to go ahead and start with the first question here. Is there a reason why teen health issues are not included in the dashboard?
There is, actually, I've noticed a couple of questions about specific kinds of measures, teen health, asthma, and possibly one or two others, asking, where's a place for these in the dashboard? And it's a great question. We had to make a lot of tough choices, and we weren't able to include measures that cover the entire waterfront and keep it kind of manageable and focused at the same time. And some of those trade-offs were conversations that we came from our conversations with our city partners. We do have a measure of teen births in the dashboard. So that is but that's the only teen-specific measure that is there currently. Over time, it is possible that we will be able to add additional measures. Really, as you can imagine, we've been putting a pretty much effort into sort of getting things really tight for the measures that we do have. But hopefully in years to follow, there will be opportunities actually to include additional measures.
Great, thank you. This question coming in from Betty Ramirez. Should the dashboard only be used as a benchmark tool?
Another great question. I would say that the dashboard is probably most powerfully used as a priority setting tool. It really should help snap into focus where is the greatest need in a given city and community, and why, and also in sort of doing that parallel thing, which is to set a benchmark. But it's not benchmarking for the sake of benchmarking. It's really priority setting, and with external benchmarks as guideposts. So I would think of it as a priority setting tool above all.
Great. Can you? This is from Dottie. Can you look up any city or just the 500 cities that you mentioned?
So in the dashboard, we only have so it's the 500 largest cities in the U.S., but we actually, we took out the last 3 from the list. So it's the 497 largest cities from the U.S., and then a city from West Virginia, Wyoming, and Vermont that are not included in that list, just to make sure that we have national representation from every single state. So yes, so it is it's those 500 cities. And
so essentially cities that are population 65,000 and below, we are not included in the dashboard at this time.
Great. This question is for Brittany. Brittany, can you talk a little bit more about the workplace wellness scorecard and how you were able to get that started and get people to come together to use the dashboard to inform that?
Sure. So we have a working group around several partners. I believe we have about 10 to 12 community organizations that we work with. to help make that a possibility. It's really led by our public health district, but we have several nonprofits as well as some business partners that are at the table to help move that forward. And using the CH-, we really took a look at, like I said, our obesity rates, our walkability rates to help encourage and target businesses in areas where we might have high obesity rates and low walkability rates. But we also took a look at some other factors related to health, such as we looked at smoking rates and that sort of thing to help inform our process. So really, our workplace wellness scorecard focuses on 3 areas. It focuses on a healthy environment to walk around in or to promote exercise, healthy environment around healthy eating. So does your workplace offer certain incentives for lunch, as well as a smoke-free environment? And whoever asked that question, I would love to follow up with you afterwards as well.
Thanks. This question is coming in from Chandler. Is it possible to extract data, example, create a CSV file? And then he has a second part. For large cities like Chicago, is it possible to compare neighborhoods?
Jessica Athens, our lead on the data and analytics and the whole engine, really. You want to take that one?
Yeah, so we will be providing CSV files of the data by state. So in the file, you'll be able to download all the data for all the cities in your state, and that's probably the most efficient that we can do it this year. But we hope to improve that accessibility next year. Also, comparing neighborhoods within Chicago, it's a great question, a good idea. Right now, it's not set up to do that, but you know, if you download the data and you can overlay your neighborhoods on the census tracts, there's a way to aggregate it. So at this stage, that's not an offering on the site.
So, and just whereas the city compare is,
right,
but census tract compare feature was not possible at this stage.
Great. This is from Margarita Udis. Do you anticipate placing asthma data onto the dashboard in the future?
We don't have a plan to do that at this time. There is available through the CDC's BRFSS data, and through, in fact, the 500 cities analysis that they did at the city level of the BRFSS data, a measure of adult asthma. So if a city is especially interested in that, that data is available through the 500 cities initiative. Childhood asthma or asthma rates or hospitalizations or emergency department visits or exacerbations, which is really often of a special interest to those of us in public health, is not there. We weren't able to find a good national data set for that we could then break down to the city level. But if anyone does have a suggestion about that, we're of course very open to thinking that one through.
Great. And can you tell us how new is your data? Is it the question is it just from 2016?
It varies depending on the measure and the underlying data source. So, but most of them are from 2015 or newer. So, so on all of the pages on the website, metric-based pages, it will tell you the data source and the years of data, but most of them are within the past 2 or 3 years.
Great. And another question here, a related question, is how often will the metrics refresh?
They are refreshed as often as the underlying data sets are refreshed. So, for example, if we're measuring using national vital statistics data that is drawn against a national survey that is conducted annually, as soon as that is updated, we will update our data and upload it to the site. So we're not going to do simply a 1-year let's say, an annual refresh of the data. If the underlying data set for a given measure has been updated officially at any point, we will, our goal is to refresh the data for that measure on the site in as close to real time as possible.
Great. Question coming from Gina Peterson. Can you talk a little bit about the difference between the county health rankings and the dashboard? Is the big difference the ability to drill down by city level?
That is the big difference. The county health rankings is totally fantastic, kind of sister site, if you will, and really paved the way for much of this kind of resource in general. I think the difference with our site is exactly what the question gets at. It's that the measures, the data, the numbers on our site are specific to the actual boundaries of the city, and for about half of the measures, a little over half, to within city divisions at the census tract level, as you saw on the maps. So there's a level of A, of granularity, and B, of being specific to the city that many city managers and health department and public health and community people had expressed a strong desire for. So that's really the difference. It's the difference in the level at which it's reported. The other difference in sort of approach is that it's not a ranking. We're not ranking cities, and that's just a difference in format and approach.
Great. Question for Brittany. Brittany, since you're the one panelist who has had some time to spend using the dashboard and working with other city partners, do you have any tips or advice for the folks that are on this call who are eager to start using the dashboard and collaborating on how they can get started?
Yes. Thank you for asking. I would say when you're working with professionals that maybe work in the health area, that's a great start. But if you introduce this dashboard right away to community members who might not be used to playing with data, sometimes it can be a little overwhelming. And so I love the way that Shoshana guided through the website today, really picking out a few key indicators that you want to take a look at and drill down in. So when you're first introducing this to the community members you work with, I would say not to kind of give them the whole website at first, because you'll get off into rabbit trails that you weren't necessarily intending to go out into. But I will say for us, it's been really exciting to see the connections that we've been able to make, especially with the excessive housing burden costs. We have a partnership right now between our SQHC and a nonprofit law firm that are really trying to get at some of our excessive housing burden costs and really using that information to target some of their efforts. And so I think really also sharing this with entities that you might not necessarily think are looking at health data, but they really can use this information to start targeting their interventions.
Great, thank you. Are you able to compare mortality rates across census tracts? That's the next question.
Unfortunately, no, we don't have mortality data available by census tracts, but we do have it available disaggregated by a demographic subgroup. So you could compare within your city mortality rates by race, ethnicity, and gender in most cases. So there's some level of granularity, but it's not geographic.
Thank you. This is a question from Kristen Weissen. It would be very useful to give specific information to cities about how much they will have to raise BRFS samples to monitor change over time. Our country could use a more robust population health and social determinants monitoring capacity, and your site will help motivate improvements. Do you have any tips or comments on that for any of the panelists?
I mean, Lorna Thorpe, were you going to say something?
No, this is just a really great challenge, but I think, you know, the more we have active data users and demand, I think that's the biggest motivation for our federal partners to facilitate this type of data collection.
Great. A couple more minutes here for questions. This is from Amy Campbell. Have you, how do you identify who is the key contact within a city with whom you are already providing this data? And second part of the question is, have you considered inclusion of adverse childhood experiences, ACEs, within the dashboard, even as broken out across criteria, which would also include community level adversities such as poverty or structural racism or witnessing violence?
So that's a really great question. I mean, ACEs, you know, are really, really vital as a predictor of later health, mental health, and kind of overall well-being in communities. So we don't currently have a plan for that. As Dr. Gravich mentioned, you know, we want this site to not burden cities with data collection. So we've been looking for centralized sources for all of our measures. And that also ensures that measures are comparable across cities for our comparison feature. And so we don't at this time have a national source for ACEs. If you have one, we would love to talk to you about that, and contact information is in the next slide, so feel free to shoot us an email if you want to talk about that further. And then for your first question, we have connections with a couple of cities that we've been working with, our pilot cities, and then another group of cities on our city advisory committee that have really helped us shape the site. And for other cities across the country, our primary contact, or our kind of first step for creating primary contacts, would be to go through the local health department, or within either the mayor or the city manager's department, trying to find a connection there.
Great. Perfect, thank you. And one more question here is about, can you talk a little bit more about how the dashboard was created? What was the idea behind it?
Sure. The idea behind it was really to develop a resource that could be a one-stop shopping resource for data about not just health status, but about what drives health. So the health determinants, and also equity, to give really a comprehensive picture to city and community leaders that would help them in setting priorities and then taking action for population health improvement.
Great. Perfect. Well, thank you. Well, that concludes our question and answer portion. So I'll give it back to Mark here to close.
Oh, really just, thanks, Alicia. Really just to add my thanks to everyone on the call for your participation today, to encourage you to join the launch webinar, some of which you will have heard before, but there'll be new wrinkles too at 1 p.m. on the 15th. To follow us on social media, join our Thunderclap, email us with questions, and use the City Health Dashboard frequently and often, and in good health. So it will be accessible completely publicly to all of you starting on May 15th. There'll be it's still protected for the next 10 days while we make final adjustments to the data, and we greatly look forward to working with you to improve population health. So I think that concludes our webinar today, and wishing everyone a great rest of day, and we look forward to remaining in touch around these issues. Thank you.